If you have battled allergies year after year but just cannot find any real improvement, it may be time to investigate if there are other sources of your problems. Dr. Kandula is here today to chat about something else that complicates things for 90% of all people who suffer nasal congestion due to allergies. Great to see you this morning.
Great to be here.
Thank you so much. I think this is important to talk about because I think some people just grow to accept, oh, I have allergies, or oh, I have chronic sinus problems, or sinus infections even. But sometimes there's another answer.
Yeah, there usually is. I mean, so there's sort of like the common misperception that, no, there's nothing that can be done, I just have to suffer from this. And, you know, there's a limit on what can be done, but most people haven't even come close to exhausting or exploring all the options that are there.
Yeah, or getting true relief and seeing true improvement. So how many people do you estimate? Because I always wonder about this. It seems like this time of year everybody has allergies, but are there some numbers in terms of how many people have this?
It's a lot. So seasonal allergies, about 50 million Americans.
Wow.
And then there are many folks who have both seasonal. So seasonal means just the obvious thing. You come spring, come summer, come fall, that you're noticing issues. But then most folks who have seasonal allergies also have perennial allergies, meaning year-round allergy issues. So it gets really confusing because the common question I get is, well, I'm always stuffy. How could it be allergies? And well, you might be allergic to something year-round. If it's obviously in springtime when things are blooming, it's a little more cut and dry. But again, there's sort of what folks think they know, and there's the true knowledge or true truth that's there, and oftentimes there's a disconnect.
And I think there's a lot of confusion, but some of those year-round allergies are things I suffer from: mold,
dust is real common.
All those kinds of things that can even be in our own homes. It's interesting to think that there are so many people who are suffering and treat it with over-the-counter remedies or things where they're really not getting the relief they need. And sometimes it's actually an anatomical problem, right?
Yeah, oftentimes. So the sort of the lowdown on allergy issues is that if you have a stuffy nose because of your allergy issues, allergy medications are not going to really do much for that. So allergy meds do a pretty decent job of sneezy, itchy, runny, those sorts of things.
The antihistamine
Antihistamines, great. But if you're feeling stuffy either seasonally or perennially, then almost assuredly there's something else in the mix, and that something else is that things are shutting down. So, really what allergies are, your body's reacting to things that it shouldn't. When your body reacts to things that it shouldn't, it tries to shut them down. To shut them down, it just tries to close things off. And so some folks get that, just acutely, where all of a sudden you feel like you got a stuffy nose. But if that's happening day after day or season after season, then the body just sort of wants to just shut it down, keep that stuff out. It's its own mechanism of defense mechanism of just sort of, let's just try to keep, stop breathing. And so then we're not going to have the allergy stuff in our nose anymore.
Is the congestion then that goes maybe along with your allergy problems, is that a sign that maybe you should have it checked out?
Absolutely. I mean, so, again, if you're doing fine and, if your meds and things are working, or you can just avoid certain things, wonderful. If it's not, then by all means get it checked out. A lot of folks sort of, I guess the other sort of flip side of that coin is folks who get checked out, it's sort of, well, what are they doing to check you out? I mean, so the problem is a lot of times you go in and see, urgent care or primary care doc, and they're going to want you back on those same meds that you tried before, and it's just this circle of not particularly helpful
and
information.
Frustrating.
Yeah, absolutely.
And I always think of you as ear, nose, and throat specialist, which I know that you are. But part of what you do, I feel like, is really looking at the overall breathing problems that someone has.
Yeah, absolutely. And we've got a board-certified allergist on staff. So really, for us, it's a matter of just, for folks who see us, it's like, come in, we'll figure it out. You don't need to worry about, trying to figure out what's going on. If it's an anatomic issue, we're going to identify it. We're going to offer options to potentially correct that. A lot of our options nowadays we can do in the office. If it's purely an allergy issue, it's really rare that somebody's got purely allergy issues without any anatomy issues. But if it's purely an allergy issue, then wonderful. We've got medications. We got different medications than what are there over the counter. But then there are other treatments for allergies other than just medication. So you can actually retrain your body to stop reacting to that stuff. And so for our patients, it's really, let's get it all in front of us. Let's figure out what's going on anatomically, what's going on allergy-wise, and then let's get a game plan together on what's the right fit for you. So for some folks, procedures are the last thing they want to consider. That's great. And vice versa. For other folks, it's sort of, I want to try to get things open, and then I'll deal with my allergy issues. That's great. So it's not one size fits all. But if you don't understand what's going on and you don't understand your options, how can you, sort of really get where you need to be.
And is it clear to you through testing or your observation of people, is it clear to you if it's an allergy problem or if it's anatomical or both?
We can make it clear. So sometimes sometimes it's, some folks don't want to go through the testing, and okay, we'll try to figure it out. But if we need to know, we'll know. We can figure it out definitively, anatomic, allergy, or both, and treat the issues at hand.
Do you also work with someone's primary care physician after you take a look at them to kind of work with that doctor
absolutely.
And physician to kind of come up with a great
I think once we have a
treatment
game plan, then that plan, if it's going to be a procedural side of things, we need to take care of that. But if it's more just sort of maintenance, then that's something that we can certainly get a game plan together and sort of, we don't want to push folks away, but make sure that they're doing well, then it's an easy sort of cruise control kind of a thing.
And it's, I think, very much the case that people suffer during the day, but a lot of people have sleeping problems related to these breathing issues too.
Absolutely.
You have a couple of free events coming up next week. One is on Tuesday and one is on Thursday. So Advent's physician experts are going to have this free public program on the difference between allergies, sinus, and asthma issues, as well as minimally invasive treatment options that are available now, including private one-on-one meetings. So make sure you take advantage of this. All you need to do is register because it's free. The first one's happening next week, Tuesday, April 25th at 6 p.m. at their Wauwatosa location. The other one is Thursday, the 27th at 6. That's in Mequon. To register, go to advent.md/event-form or call 414-771-6780. They have one office on Mayfair Road in Wauwatosa and another one on North Port Washington Road in Mequon. Always great to see you.
Always great
Thank
to be
you
here.
so
Thank
much.
you.